Good afternoon. Today we'll be talking about the sun and the dangers of the UV rays that come from it and how to protect your skin from the UV rays. UV stands for ultraviolet radiation, and it can be found in sunlight and in tanning booths. The ultraviolet radiation in tanning booths are much more concentrated than those coming directly from the sun. That is why you can only be in a tanning bed for a maximum of about 20 minutes in most salons. The rays from the sun and in tanning booths are harmful to the skin and can be harmful to anyone, no matter how dark your skin is naturally or how light it is. What happens is the UV rays penetrate deep into the skin where the melanin is located. Melanin is the pigment in the skin, and the more melanin you have, the darker your skin will be. The UV rays activate the melanin and produce more pigmentation. This is what causes you to tan when out in the sun or in a tanning bed. When penetrating deep into the skin, the UV rays affect the connective tissue and blood vessels, causing the skin to gradually wrinkle. So that means people who tan more often are more likely to experience more wrinkling of their skin at a very early age. A sunburn is one of the effects of the UV rays hitting the skin. It occurs when you have an overexposure to ultraviolet rays. The ultraviolet rays penetrate into the skin and will kill off some of your living skin cells. Sunburns can be very painful, especially when they're touched or rubbed in any wrong way. Some symptoms of sunburns are redness and tenderness of the skin. Skin will feel warm to the touch, and in some very severe cases of sunburns, blistering will occur, and in some cases, dehydration will also occur, causing the person to become dizzy and disoriented, and the person sometimes may pass out due to the dehydration that has occurred. Days after the initial burn, the damaged skin will begin to peel away, and the skin will eventually go back to looking how it used to, go back to looking normal. Although the redness and pain of a sunburn will go away in just a couple of days, there are still some long-term health effects that can happen, like skin cancer or long-term skin damage. If you do get a sunburn, there are certain things you can do to relieve the pain of it, to make this experience a little bit less dreadful. A cold shower can help cool you down, cool down your skin. It will feel pretty nice on your skin because your skin is so hot. It's better to wear loose clothing than tight clothing because tight clothing will rub up against your skin, and that's just not a very comfortable thing when you have a sunburn. You need to let your skin breathe a little bit. You can also take ibuprofen, Advil, or Tylenol to help relieve some of the pain that the sunburn is causing. And applying lotions and moisturizers can help prevent the skin from drying out and relieve some of the discomfort that's happening. There's quite a few kinds of skin cancer that exist, and almost all of them can be linked to sun exposure. The two most common types of skin cancer are basal cell carcinoma and squamous cell carcinoma. There's a 1 in 5 chance of getting one of these types of skin cancer before the age of 65. Basal cell carcinoma can be identified as a fleshy lump or tumor on the skin. Basal cell carcinoma does not spread to other parts of the body, but if not caught, it will slowly get bigger and bigger with time. It's really rare that this cancer will be fatal, but it can result in death if it's not treated or taken care of before it spreads or before it gets bigger. Squamous cell carcinoma can be identified as patchy red spots on the skin. it can cover quite a large area of the skin. And this kind of cancer does spread to the other parts of the body, but it's also very rare that this cancer will be fatal. There's a very high cure rate for both of these, basal cell and squamous cell carcinoma. The one we really got to watch out for is malignant melanoma. It's the scariest of all the skin cancers because it is the most deadly. It's the most rare, but that doesn't mean it won't happen. It's one of those causes. It is the one that causes more than 75% of deaths from skin cancer. The warning signs of malignant melanoma will be discussed momentarily. People with fair skin are the ones that really need to be cautious of the sun and its effects. The sun will affect fair-skinned person at a much quicker rate than people with darker complexion. A fair-skinned person can be out in the sun for just a couple of minutes before they start to develop a sunburn. The more times a person's skin is damaged by UV rays, the more likely that person is of developing some sort of skin cancer. Regardless of your complexion, though, you always need to be cautious of the sun exposure and protect yourself from it. Skin cancer is not exclusive to fair-skinned people. Anyone is at risk of getting skin cancer if not properly protected from the UV rays of the sun. When examining a mole on your body that you think may be cancerous, you can use the ABCD rule. What you do is you look for any of the signs that I will list. The A stands for asymmetry. If the mole has sides that are not symmetric, this could be a sign that it is malignant melanoma. The B stands for border. The border of a melanoma mole is rough and rigid and not smooth like a normal mole. The C stands for color. If the mole is not one solid color and has patches of black or brown in it, it could be melanoma. And the D stands for diameter. The diameter of a mole should be no larger than the eraser of a pencil. If you notice any of these things on a mole that you have and are concerned that it may be malignant melanoma, see a doctor and get it tested. With all that being said, there are multiple ways that a person can protect their skin from the sun. The UV rays from the sun are the strongest between 10 a.m. and 4 p.m. So if at all possible, try to avoid sun exposure between those hours. A lot of times that's not very plausible, so there are a lot of other ways that you can protect yourself. When you're going into the sun, especially from 10 to 4, make sure you apply sunscreen. You want to apply about 30 minutes before you go out in the sun and reapply every 2 hours. A higher SPF means that a person can stay out in the sun longer before developing the effects from the sun. An SPF of 15 means a person can stay out 15 times longer than normal before the rays start taking their toll on the person's skin. SPF 30 means 30 times, they can stay out 30 times longer, and so on and so forth. There are some water-resistant sunscreens, and people usually think that those don't need to be reapplied because it's not rubbing off and the water's not taking it off when I'm swimming. But even water-resistant sunscreens need to be reapplied every 2 hours to avoid getting sunburn. If you don't have any sunscreen and still want to be safe from the sun, you can wear hats, pants, shirts, anything that's going to cover your skin and aid in protecting you from the harmful rays of the sun. Just at all times when you're in the sun, to avoid the harmful effects that the sun can have on your skin, just protect yourself. No tan is a healthy tan. A tan skin is damaged skin, so just keep that in mind. Thanks for watching.